What would you do if a doctor told you to remove both your breasts to stop cancer, but someone else handed you a herbal drink instead and said, "Trust me, this will heal you"? Now, that's exactly what one woman claims happened. But is it true? Is it a miracle? Or something more dangerous? Let's find out.
My name is Barrister Gabi Ifoma. 2020, I was diagnosed benign 1 and 2. But the doctor said I should hold on a bit since the thing is coming up small. But I keep feeling pains. At a point in time, I was not feeling pains anymore. Last year, 2023, the pains began again in my two breasts, especially this one. I couldn't bear the pains. I had to go to Ifako Clinic, General Hospital. Ifako referred me to LASUT, Lagos State University Teaching Hospital. I went for mammogram and went for prolactin to check what is wrong with the breast. The result came out that the two breasts is affected. Then they said I should go for histology, whereby Dr. Larewadu carried out the test. After the whole thing, the result came out. He called me. He said that I'm having malignant. He said I'm having cancer of the breast. I said, what is the next thing to do? What is the solution? He said before it started spreading to my bloodstream, I had to remove the breast, even the two. I said, why not remove one and leave one for me? He said the two has been affected. I said, great, how much is it going to cost? He said the both breast is going to cost 1.4 million naira. I accepted to remove this breast until I met a man called Mr. Anthony Chid Uba that introduced me to this drug, Jinja Herbal extract. He said, please don't remove this breast. I should take this drug. If this drug did not work for me, he is going to pay me ×2 of the money I use in buying them. I said, okay, with faith. I said, okay, let me use it. I keep drinking. And I was telling him, I said, Chid, it's like something is moving around my breast. The breast is getting soft. The breast is getting healed. Blood is no more coming again. He said I should not stop. I should take it for 90 days. Please, whoever that is having a breast cancer or an issue and somebody advised you to take so solution, please don't give it a doubt. Take it and see outcome of the results. My breast is no more paining me. It's now a soft. I never removed the breast. The breast is still there. I now wear bra. God used Mr. Chidi Oba to heal me. Today, I am 101% okay. I cannot do without this ginger extract. I now take it as my water. I'm going to tell the world, the people outside there about this drug. Let them drink. At least it's not 700,000 naira, which they want to use to remove the two breasts. The two breasts is 1.4.
That was a lot. When I first came across this video, it was just someone's WhatsApp status. But then a few days later, someone else sent it directly to me, asking if I thought they should also take the same herbal drink for a similar health issue. And that's when I knew I had to speak up. Because while I am happy this woman says she feels a little bit better, and I genuinely respect her right to share her story, I also have a responsibility, not just as a medical doctor, but as someone people trust, to look deeper. Now, let me say this very clearly. This is not an attack on herbal medicine, and it's not a campaign against ginger herbal extract. The real issue here is potentially deadly misinformation. When people are encouraged to abandon or delay proper medical treatments based on personal testimonies like this that have not been medically verified. So let's pause the emotion for a moment and let's ask, does her story actually make medical sense? Let's break it down together. Let's start with her diagnosis. She said, and I quote, "In 2020, I was diagnosed benign 1 and 2. This is not a medical diagnosis. There is no such thing as benign 1 and 2 in oncology. If a breast lump is benign, it has a specific name, like a fibroadenoma or a cyst. So right from the beginning, there is already confusion around what was actually told, or what she was told was her diagnosis. Was it a cyst? Was it a lump under observation? We don't know. And later, she now says she was told she had malignant. Again, no mention of the type of cancer, the grade, the stage, or even the receptor status, which are all standard parts of a real breast cancer diagnosis. Next, she said the hospital asked her to do a prolactin test to check what was wrong with the breast. Now, I want you to listen carefully. Prolactin is not a test for cancer. It's actually a hormone we check when a woman has unusual breast milk discharge, not when investigating a lump or a suspected tumor. Now, for a proper breast cancer workup, we look at things like mammogram, ultrasound, core biopsy, and sometimes some other advanced imaging, and definitely not prolactin. So again, we are seeing a mismatch between the story and the standard medical practice. She says she was told she had cancer and needed to remove both breasts. But here's the problem. She mentions a biopsy, but we never hear the actual diagnosis. No histology report, no grade, no receptor status, nothing. Also, where is the staging workup? Before any surgery, especially something as drastic as removing both breasts, we check for spread. That includes tests like ultrasound, chest x-ray, and a CT scan, or a CT scan, and definitely some blood tests. No doctor in their right mind would just say, "Madam, you have malignant, remove both breasts," without clear evidence. That's not medicine. That's not how cancer care works. Not in Nigeria, not anywhere in the world. So far, we've seen vague diagnosis, irrelevant tests, and a cancer story that just doesn't add up. But we haven't even touched the most dangerous part, the so-called healing. In part 2, we'll talk about what it really means when someone says, "The pain is gone, my breast is soft, I'm healed," and why that kind of thinking can put real lives at risk. I'm Dr. Chuks, and what I stand for is simple: truth, compassion, and medically sound advice that can actually save lives. So if you believe in protecting people from false hope and want honest conversations about faith, health, and evidence, then I invite you to be part of this movement. Like this video, drop a comment below, and most importantly, share it with someone who needs to hear this. I'll see you in part 2.